emotionally, financially. And as it continues to wreak havoc on supply chains and commodity prices, I know so many individuals and families are seeing higher prices at the grocery store checkout, and businesses are facing delays in getting supplies and materials. So today I wanted to start with some good news. I was glad this last year to sign one of the largest tax cuts in state history to provide a 10% tax cut to middle-class families. This means altogether since taking office, I've signed tax cuts that will provide a tax cut of 15% or more to 86% of Wisconsin taxpayers. On top of this, I was also glad to announce earlier this week that Wisconsinites will start seeing more money in their pockets in the new year. Wisconsin's tax withholding tables, which decide how much income employers withhold from taxes, for taxes from paychecks, hadn't been updated since April 2014. So we made updates that will ensure Wisconsinites will see hundreds of dollars in their paychecks. Just to give you an idea of what you'll see over the year, a single filer making $50,000 will see $551 more in their paychecks, while a married couple each earning $50,000 combined will see over $1,200 more for their household in their paychecks. Making sure Wisconsinites have the extra help to make ends meet is critically important right now, especially as folks in every corner of our state are seeing COVID-19 cases surge as Omicron variant continues to spread. Folks, I know parents and educators are worried, and as a former educator and grandparent, I share your concerns. We've committed to continuing to work together with our school districts, our educators, and our parents to protect our kids and school staff from COVID-19. We want our kids to be in the classroom. And just as we have since the beginning of this pandemic, my administration continues to work to provide the necessary support and resources for our kids, our educators and districts, the things they need to be safe, to make sure that they can keep students and educators in the classroom, a priority we all share. We've been working with schools on DHS's school-based testing program. This program received federal funding and provides free, safe, and flexible testing for teachers, staff, students, and their families. Testing remains a critical component of slowing the spread of COVID-19. And regular testing can help support schools in making important decisions to protect the health and safety of those in their buildings. So we're encouraging schools to sign up to participate in the program. We also know the best protection from getting seriously sick, being hospitalized, or dying from COVID-19 continues to be the safe, effective COVID-19 vaccines. That's why we're also encouraging schools to host school-based vaccination and booster clinics with the help of DHS during drop-off and pickup times. All kids ages 5 and older are eligible for a COVID-19 vaccine. And the CDC recommends all kids ages 12 and older receive a booster 5 months after their first vaccine series. Schools are uniquely positioned to help educate families about the benefits of the vaccine, as well as meet kids and parents where they are and in their own neighborhoods. Bottom line is that for the last 2 years, educators and parents have gone above and beyond to do everything they can to make sure our kids are in the classroom. So we will continue to support them and their efforts any way we can, just as we have since day one. Additionally, we're continuing to do everything we can to increase staffing support, as well as our healthcare workforce, hospitals, and other healthcare systems. Omicron is now the dominant strain of COVID-19. The 7-day average of new confirmed cases has increased 70% in the past 2 weeks, with kids under 18 representing the highest number of cases. Obviously, this has a significant and serious effect on our healthcare systems. We've all seen the tragic story of individuals who need urgent care or treatment, whether COVID or not, but can't get it because our hospitals are full. That's why we announced today we will be partnering with Madison College to help train members of the Wisconsin National Guard as certified nursing assistants to bring staffing relief to Wisconsin's care facilities. We're estimating the first round of staffing relief will allow skilled nursing facilities to open up 200 or more beds by the end of February to receive post-acute care patients in order to free up capacity at hospitals. We've seen time and time again that the Wisconsin National Guard is indispensable and can stand up to our most pressing challenges. And as we continue to see COVID-19 cases and hospitalization surge, we are pursuing every available option to bring needed staffing support to Wisconsin's health systems. There's several ways you can join our efforts to support our healthcare workers and infrastructure. First, unvaccinated individuals continue to make up the vast majority of hospitalizations. So please go to get a COVID vaccine. Go to vaccines.gov and find an appointment near you today, tomorrow, or as soon as you can, and get boosted if you haven't already. Additionally, you can help our healthcare systems by doing your part to prevent the spread. Get tested and stay home if you feel or know you're sick. Getting tested also continues to be an essential part of our response to this virus. Beginning January 15th, health insurers will be required to cover the costs of over-the-counter at-home tests for their members. Additionally, we also continue to have testing sites all across the state, from our local pharmacies to county health departments. So Wisconsinites, please don't head to the ER to get a COVID-19 test. Prevent further strain on our healthcare workers and systems by dialing 211 to request an at-home test, buying an over-the-counter at-home test, or going to the DHS website, finding a testing option near you. Finally, you can help our healthcare workers by treating others with kindness, respect, empathy, and compassion whenever you're at the doctor's office, in the ER, getting a COVID test, or having any interaction with our healthcare system. You name it. Please be patient. Please be courteous. Please be kind. Everybody is doing their best and trying to keep you healthy and safe. Our communities have come together in amazing ways over the last 2 years. And while at times it felt like everybody else was divided, Wisconsin communities have been stronger than ever. So let's keep it up, Wisconsin. Let's beat this virus together so we can make sure our economy continues to recover, our kids stay in the classroom, and our healthcare workers can do their important work. So thanks so much. Now I'll turn things over to DHS Secretary Designee Karen Timberlake. Karen, it's all yours.
Good afternoon. Thank you, Governor Evers, and thank you all for joining us today. It's important that we all remain vigilant, just as the governor said, in our fight against COVID-19. As we continue to see record-breaking cases due to the Omicron variant, we must continue to do all that we can to protect ourselves, our loved ones, and our communities. Here are today's latest COVID-19 data and trends. As of today, 62.7% of all Wisconsinites have had at least one dose of the COVID-19 vaccine, and 58.6% have completed their vaccine series. Additionally, Wisconsin vaccinators have administered more than 1.7 million booster and additional doses of the COVID-19 vaccine. Today, we are reporting more than 13,000 new confirmed cases, bringing our 7-day average of new confirmed cases to 9,915. We are sad to report our total confirmed deaths have now reached 10,434, and our thoughts continue to go out to the families and friends who have lost someone to this disease. As the governor noted, our healthcare systems are still under tremendous pressure due to an increase in cases and staffing shortages. Statewide, 95% of intensive care beds and 95% of intermediate care beds are currently in use. As of January 12th, 2,278 Wisconsinites are hospitalized with COVID-19, which is an increase of 276 patients in 1 week. 488 of these patients are in the intensive care unit. DHS continues to work with partners across the state to address staffing shortages in our healthcare facilities. Since October, we have recruited 626 nurses, nursing assistants, and other types of healthcare workers to support health and residential care facilities. We are reconfiguring the deployment of our Wisconsin National Guard personnel, and as of today, have placed approximately 50 Guard members at 6 skilled nursing facilities around the state. This effort is expected to free up about 78 post-acute care beds to provide relief to Wisconsin's hospitals. And as the governor noted, we announced earlier today the partnership between Madison College and the Wisconsin National Guard to train additional Guard members as certified nursing assistants in order to support staffing needs in our healthcare facilities. Partnerships like this have been lifelines in helping to ensure our healthcare system remains strong. And we also need the public's help to support our healthcare systems. As Dr. Ryan Westergaard has noted previously, although our recommendations are really the same, we are urging people to hear them differently. Please hear this message differently because we are in a different place. Although the good news is that early research is showing Omicron to be less severe than earlier strains of the virus for many people, especially for vaccinated and boosted people, the risk to our communities has never been more dire. If we do not protect capacity in our healthcare system by protecting ourselves and our family members from contracting COVID-19, Wisconsinites experiencing medical emergencies may not be able to receive immediate life-saving attention and care. We have heard healthcare providers in Wisconsin and around the country sounding this alarm, and we need to hear them and take steps accordingly. Each one of us needs to actively work to avoid unnecessary exposure to COVID-19 in our own lives. Please get vaccinated and get a booster dose if you're eligible. DHS now recommends a booster dose for everyone 12 and older. Wear a well-fitting mask in public indoor settings. Stay home if you are sick, and keep your children home from school if they are sick. And please follow your school's isolation and quarantine guidance. Get tested if you're experiencing symptoms. Taking these steps will protect your health. It will protect the health of those you care about. It will protect healthcare capacity, and it will support our teachers and school staff in keeping schools open and in-person learning happening for K-12 and college students. Thank you, and I will now turn things over for your questions.
Thank you. And a reminder to maintain audio quality, please remain muted until it is time to ask your question. And if you're able to do so, use *6 to mute and unmute your phone. And because we do have to wrap up at 2:15 today, we ask that you please limit yourself to one question so we can try to get everybody in. And we'll begin this afternoon with Rob Sussman from WTIQ Radio in Green Bay. Rob?
Hi, yeah, thanks for holding this. While you were doing your briefing, the Supreme Court blocked the COVID vaccine mandates for businesses from being enforced. I was hoping maybe to get a quick reaction from every member of the panel. Thank you.
Well, I'll just jump in first. Clearly, that request from the federal government was going to end up in the court, and it's still going to play out. You know, from the beginning, we've always had some concerns about that, but at the end of the day, you know, we have to make sure that businesses aren't burdened by this. But going forward, people can still get vaccinated. That's the easy answer to that. But it's still going to play out further, no question about that.
And I'll just add that there is absolutely a role for businesses across our state to continue to play, just as the governor noted, in combating COVID-19. We have had many great partnerships with private sector employers who have been offering on-site vaccination clinics, who are offering on-site testing, who are making it possible for their employees to take the time off that they need when they are sick and need to be out of the workforce. So regardless of today's decision, there is plenty of work for us all to do together to continue to combat COVID-19.
Thank you. Our next question belongs to David Wahlberg from the Wisconsin State Journal. David?
Yeah, thank you. Do you have any data on how much booster shots in Wisconsin are impacting rates of infection, hospitalization, or death with Omicron circulating now?
So David, you're asking about whether we have looked specifically at new infections, hospitalizations, and deaths for those who are boosted as compared to those who are not. I'm not aware that we have done that. Understand the question, and I think at a national level, certainly what we're seeing is that the booster dose does provide that additional layer of protection. I'll pause to see if Dr. Westergaard might be aware of anything else.
No, we fully expect that the benefits of boosters will be played out at the population level, but the data we have really come from studies of individuals showing that the immune response is in fact boosted quantitatively, meaning more antibodies, and studies in hospitals showing that people who are hospitalized are much less likely to be unvaccinated compared to vaccinated, and even less likely if they're boosted. So, every reason to believe that with boosters are continuing to save lives in Wisconsin, as we expect they are across the world based on the data we have.
Thank you. Now to Jason Zimmerman from WBAY-TV in Green Bay. Jason. WBAY-TV. Okay, we have to move on then to Eric Gunn from Wisconsin Examiner. Eric?
Thank you for taking the question. You mentioned schools and testing at the beginning of the session, and just today I heard from anecdotally that schools in some parts of the state anyway seem to be running out of antigen tests used to test students and staff, and that some districts have told people to submit the results of at-home tests, which may also be somewhat difficult to come by. So how widespread is this problem? What's the situation on testing availability, particularly in schools? And is that making it harder to keep up with the demand for testing? And what are the prospects of resolving that? Thank you.
Right, great questions. So as of today, we have over 78% of all the public school districts in our state who participate in our school-based testing program. And we have 20% of private schools and independent schools across our state that participate as well. They are working with a wide network of vendors who offer principally PCR testing in schools. Some also have been offering antigen testing. It is certainly the case that antigen tests we know have some national pressures on that supply chain. We're seeing many efforts coming from the federal government to increase the supply of antigen tests. We also got some very good news yesterday that the expiration date on some Binax tests was extended by 3 months, so that's going to help. But what I'll say generally is that schools have access to PCR testing through these vendors, as well as antigen testing where it's available. Just in the month of January, we've already conducted over 26,500 tests in our schools through our school-based testing program. So we will keep up this pace as long as we need to.
Thank you. The next question belongs to Denise Lockwood from Racine County Eye. Denise?
Hi, thanks for taking my call. My question is around funeral homes and being able to address the backlog of people dying. I've got several stories around morgues being full, and some hospitals in the area are like holding people that have already passed away in hospital beds, in hospital rooms. So I'm wanting to find out what kind of support we're actually giving some of these funeral homes and in remedying that problem. Thanks.
Yeah, thanks for the question. We do not, as of today, we have not seen a dramatic increase, thankfully, in deaths. Unfortunately, we are seeing a consistent day over day number of people who are passing away in our state due to COVID-19. We have not received reports that I'm aware that our funeral and mortuary system is being overwhelmed. I'd be happy to take follow-up information on that. What we do know is that thankfully, even though the numbers of cases are spiking so dramatically, as everyone has noted, vaccinations are protective. And so we do believe that we will continue to see some leveling of death rates in the state due to the high prevalence and the growing prevalence of people being vaccinated.
Thank you. Now on to Bruce Marcus from WRJO Radio in Eagle River. Bruce? And a reminder, *6 unmutes your phone. Bruce Marcus from WRJO. Okay, we have to move on then to Alex Moe from wisbusiness.com. Alex?
Hi, thanks for taking my question. I wanted to ask, will any more FEMA workers be coming to Wisconsin to provide further staffing support? Thank you.
I'll just jump in. We will continue to press that issue at the federal level. Yes, we are counting on the federal government to deliver in this arena. I'm in contact as well as staff with the White House on a regular basis, and so we have we have the group that's up in Green Bay that's doing a great job, and we expect that the federal government will come through with some more FEMA folks to help us.
Thank you. Now to Gabrielle Mays from FOX6 in Milwaukee. Gabrielle?
Yes, my question is in regard to the deployment of the National Guard troops. Governor Evers, can you say exactly where the troops are going? Are there any in Milwaukee County, southeastern Wisconsin?
The exact places, I'm not sure. I believe that Milwaukee and southeast Wisconsin will be getting some. Maybe Karen has an answer for that, but I know it's important that we reach the entire state of Wisconsin at some point in time. So we're very pleased that we have the volunteers from the Guard to make that happen, but the exact numbers and where, I'm not certain of.
Right, we can certainly follow up with more specifics. What I can say for the initial Guard members who have been deployed to those 6 sites, those are all around the state of Wisconsin, and that is by design, so that we create some opportunities for some relief for hospitals all across our state. And then, as the governor noted, as through our partnership with Madison College, as more Guard members are trained up, we will similarly make sure that they are deployed around the state. We have done that same thing with the staff who have been made available through our contracts with the staffing agencies. So we absolutely understand the need to continue to distribute resources all across the state where the needs are greatest.
Thank you. Now Molly Beck from Milwaukee Journal-Sentinel. Molly?
Hi, thanks for having this call. Part of the staffing problems now are because of a burnout after the last surge in 2020. And I'm wondering what are some long-term staffing solutions that the state is looking at or considering if we see a similar staffing reduction after this surge and God forbid another surge. What are you guys looking at right now to make sure that staffing gets a little bit more stable?
Well, we will continue to do what we're doing with the National Guard as long as we can, as long as they're available to us. There's a limited N of people that are nurses and nursing assistants in the state of Wisconsin, and so we'll continue to work with the folks at the federal government level and the state level to make sure that we have appropriate numbers. But I will say, long term, we will continue to do what we're doing. In this last budget, we provided resources for nursing the folks that teach nurses at the collegiate level. That's critical. I mean, we don't have enough of those people that are providing the background and the skills necessary to create the next generation of nurses. So we will continue to make sure that our higher education institutions are in a position to keep, for lack of a better term, churning out new people that are willing and able to help us out going forward.
Thank you. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding this. In terms of the National Guard deployment, can you talk a little bit about how much that's going to cost and how it's being supported or funded? Thank you.
Well, the costs are borne by the state of Wisconsin and the National Guard. In fact, I was in Madison today when we welcomed back people that were, we had a third of our National Guard forces were across the sea in the Middle East up until just today, and so that's been a problem for us as far as getting more people involved. I welcome people off the plane and encourage them to consider becoming nurses assistants and continuing their good work in that area just today. But the costs are borne by the state, and we will use federal resources if necessary.
Thank you. And now to Katie Crowther from TMJ4 in Milwaukee. Katie?
Hi, this is Mary Jo, actually, and for Katie today. Just to dive a little bit more into the National Guard deployment, can you just give a little more detail as to how many National Guard members are going to be deployed? And you mentioned the first rollout. Kind of what does the timeline look like for all this? Thank you.
I believe we're initially planning on 200 National Guards people, men and women, and those 200, they have to go through training and become a nursing assistant. And by the end of February, we believe those 200 people will be deployed.
And I can add just one more detail on that front. So as of this week, we have about 50 National Guard members who have been placed in skilled nursing facilities around the state. That's the initial phase of what we were able to do with people who already had either that CNA, the Certified Nursing Assistant certification, or had been through a shorter term temporary nurse aid training course. So those folks are already out and in the field. And then, as the governor noted, we'll have 2 more waves that are going through in-person training at Madison College.
Thank you. Next question belongs to Kent Wainscott from WISN TV in Milwaukee. Kent?
Good afternoon. This is Terry Sater, Kent's colleague, answering for Kent. What kinds of training are these National Guard members undergoing? Can you give us a little more specific about what it is they're learning to get them to be able to work in these skilled nursing facilities?
Yep, happy to hop in on that. So since the beginning of the pandemic, the governor has made it possible to have some accelerated training for certified nursing assistants and temporary nursing assistants, because we know that the kind of gold standard, the full training program, is something that we very much want people to be able to work their way all the way through. That said, we also know that through a shorter term, initially online course, followed by in-person training, we can get people ready to go out and work safely in these skilled nursing facilities with the oversight of a registered nurse, essentially supervisor or preceptor. And so the folks who are out already have gone through that kind of minimum 16-hour training course. They will then, should they choose to want to continue on and become certified nursing assistants, they will complete a longer course of study over time. But for now, we're making sure that we can get people out and into the field doing the work that these skilled nursing facilities need them to do, so that hospitals have more places that they can be discharging people and free up additional hospital beds for people who truly need hospital level care. The Madison College course is, again, a sort of interim step between that 16-hour online short-term course and the eventual full certified nursing assistant training program that people will eventually need if they choose to, again, continue on in their careers as CNAs.
Thank you. Now to Carl Cooley from WJMC Radio in Rice Lake. Carl?
Hi, my question kind of deals with the delays of COVID-19 tests. Can you say what the average turnaround time is for tests by type? What's causing these delays, and what is the state doing to help shorten the result turnaround time? Thanks.
You bet. So the good news is that the vast majority of our labs are still able to turn a test around within that 24 to, in some cases at the outside, we're hearing about 72-hour turnarounds, but we're still really in that 1 to 3 day window. The reality of it is that this is a matter of volume. So this we've been processing a record number of tests week over week. And the best thing that we can be doing to improve turnaround times is to continue to bring more testing providers who have other relationships with other labs into the equation. And so we are continuing to sign up additional pharmacies and clinics and other providers across the state, public health departments who want to be offering testing. And so what we would encourage people to do is if you've gotten a test and have waited more than 3 days for a result, we would encourage you to follow back up either with the location where you got tested, if it was not one of our community testing sites, or if it was a DHS sponsored community testing site, there's a hotline number that the media team would be happy to make available. And we would encourage folks to call after about 3 days if they haven't gotten a result. The other thing for people to know is that if you think you have COVID and you have gone to get tested, we need you to act as though you have COVID while you are waiting for that test result. So that means wearing a well-fitting mask at all times. It means, particularly if you're symptomatic, keeping yourself isolated and away from settings where you might expose other people. So we recognize that waiting is challenging for people, and we really need you to be doing what you can to keep others around you safe while you are waiting for that test result.
Thank you. Now to Ben Boken from NBC 26 in Green Bay. Ben. NBC 26. Okay, we have to move on to Mayan Silver from Milwaukee Public Radio. Mayan?
Hi there. Hi, do you have any information, this is for any of the officials, on what the state will be doing to boost local distribution of N95s and KN95s in Milwaukee? The libraries are all out, and the city health department says that health centers could run out today or tomorrow.
So those are supplies that local public health partners and others can request through the Department of Health Services. We do have a supply of masks available, and with the increasing attention around needing to wear masks due to the Omicron variant, we have seen some increase in requests. So again, I'll ask the media team to follow up with that specific information for you so that you can be sharing it out with your audience. Thank you.
Thank you. Now to Ben Krumholtz from Fox 11 in Green Bay. Ben.
Hi, thank you for the opportunity. There have been questions about the accuracy of the at-home test. Should employers and schools consider the test results to be reliable for both keeping people home and bringing them back?
This is Ryan Westergaard. I can address that. The role of at-home tests, and this was articulated in some guidance from CDC a few weeks ago, and it's been our consistent message as well, is that they can provide information for individuals who want a rapid result of whether they have COVID, and maybe an option that they consider before gathering in groups, for example. But when it comes to decisions about returning to work and returning to school, for example, our recommendation is to not use at-home tests, but use ones that are done in a supervised setting where we can be confident that the proper steps were followed and the interpretation is correct. So it's a little more controlled setting to do it that way, and that's why we've really strived to have both antigen and PCR tests available in a lot of clinical and public health settings. So they are, preferable to home tests, and we don't recommend using home tests for these consequential public health decisions about going back to work.
Thank you. Now to Todd Richmond from the Associated Press. Todd?
Hi there. Back in 2020, when numbers weren't nearly this high, you had opened a field hospital at the State Fair Park. Why not open that again at this point?
What we're finding is that the capacity that we need to build in our healthcare settings is human capacity. It is not the brick and mortar sort of physical infrastructure. What we need is people to do the work. And so what we're doing to help support our health systems in identifying additional people to provide the care we all need is contracting with numbers of staffing agencies, as I noted earlier, and placing hundreds of people in hospitals and in long-term care settings. Obviously, the focus of the work of the National Guard in creating additional capacity in long-term care settings will allow hospitals to open beds and move people into post-acute settings. In conversations with health systems around the state, there is strong agreement that this regional strategy of making sure that we can support care close to home for people, create as much capacity as we can in the existing network of healthcare providers that we do have in our state is the right strategy.
Thank you. Now to Drew Sutherland from WSAW-TV in Wausau. Drew.
Yeah, thank you for taking my question. We have noticed in our area a lack of over-the-counter medications for things like cold and flu. We're wondering if for people staying at home with Omicron who don't have the real severe symptoms, is this the best way to treat it? And then what do you say about the shortages both to consumers, whether there's hoarding like there was at the beginning of the pandemic, and also to retailers, whether or not they should limit the supply that people can buy?
Happy to have Dr. Westergaard offer the clinical guidance there.
Sure. So if I understand the question, you're referring to shortages of over-the-counter medications used to treat the symptoms of cold and flu. I hadn't heard that those are in short supply, but to answer your question, assuming I'm getting it right, is that for people who have mild symptoms of COVID-19, the symptoms can be very similar to the common cold and flu, and over-the-counter preparations that can treat cough and sore throat that people are familiar with are very appropriate to use. Now, there are antiviral medications that are now developed and authorized by the FDA, which can be used for people who are at very high risk of severe COVID-19 disease. This is a promising, exciting development. Unfortunately, right now, they're in very, very short supply. So those require a prescription and to be done in a way that gives priority to people who are at the highest risk, elderly people, immunosuppressed people, people who haven't responded well to vaccines. So if it is mild, treatment as you do the common cold is the way to go. And we have a very limited number of antiviral medications that you need a prescription for, that we will be continuing to support getting out to people as supply increases in the coming weeks. But right now they're pretty limited.
Thank you. Now to Madeline Fox from PBS Wisconsin. Madeline?
Hi there. With all the emphasis on testing, I was wondering if you could speak a little bit to testing for kids under 3. That's a population that pharmacy chains like CVS and Walgreens can't serve, and they're often, too young for school testing sites. For families who are looking for tests after they are symptomatic or they've had a possible exposure, and their childcare providers are not participating in the state program, are there ways that they should try to access testing, knowing as we do that hospital systems and pediatricians are pretty overwhelmed right now? What do you recommend for families of young kids trying to find tests that are not as easy to find for that age group?
Dr. Westergaard, do you want to speak to that in terms of some of the clinical recommendations?
Sure. So we do continue to recommend testing for people that have COVID-like symptoms because we want to understand, how many people are infected and give people the right advice. So if children develop symptoms and they're the only ones in the family who have that symptom, I would contact their pediatrician first to get advice about what to do, not assume that it's COVID or assume that COVID testing is the only thing that's needed, but get advice from healthcare professional that they would normally get. And if tests are hard to come by, I think we need to look at the resources in the community. Our public community testing sites, I believe, test people down to 2. And so the tests are available through those same outlets. The other thing that I do counsel some patients and families about that is that if people do have mild symptoms and one member of a household has confirmed COVID, it's pretty highly likely that other people who develop symptoms also have COVID. And we do consider people to have a probable case of COVID if they're exposed to another person and have symptoms that are consistent with COVID. And in those cases, we're comfortable giving the recommendations to isolate as if they had COVID without a test. So not every single person under every circumstance needs a test if we can evaluate the household setting, make sure people are not sick and give people the right advice. But our goal certainly is to make tests available to all people who need them. And people should use the variety of options that are available to get testing in the communities where they are.
Thank you. And we have time for just one more question, and that belongs to Victor Jacobo from CBS 58 in Milwaukee. Victor?
Hello, good afternoon. Thank you again for taking the call. This kind of goes back to a previous question, but we've had some communities, obviously in Milwaukee, they've gone through a large distribution of KN95 masks, but other communities in the surrounding area here have said that they've made some requests to the DHS stockpile and that the timeline of when that delivery was going to happen is unclear, and so they were trying to provide some guidance to their residents. And so my question is essentially, what does the DHS stockpile look like? What could potentially cause some delays in delivering that to communities or organizations that make those requests? And of course, recognizing that between the time that that concern was brought up till now, that may have changed. But if that continues, what are those issues? Thank you.
Sure. So maybe the place to start would be to say for organizations that are interested in requesting masks, again, we have a direct website and link that we will circulate out. In addition, a great first step is to work with local public health partners and with county emergency management. Both local public health and county emergency management officials have been just unbelievable partners throughout the pandemic and can be helpful in terms of alternative sourcing for some of these resources. I know that the stockpile does include a large number of N95 masks that are deemed not terribly suitable for healthcare settings. KN95s I'm not up on, and so that's something we'll have to continue to look into. But I think the premise of your question is right, that certainly these are supplies that folks are working to access. That's important. We need people to be wearing good, high quality masks consistently in public settings. We will do everything we can to turn requests around as we are able to fulfill them and to help advise local partners in where they may be able to source supplies that we may not happen to have in the state stockpile.
Thank you. And that concludes today's briefing. Reporters who did not get a chance to ask a question can contact the DHS media team. Our thanks to all of you for joining us today, and please continue to monitor the DHS COVID-19 web pages for data and guidance. Be safe and have a great afternoon.